Alright, so let's talk about ACE inhibitors. What are those? Okay, ACE inhibitors are medications commonly used for high blood pressure, heart failure, kidney protection, and after usually a myocardial infarction. So the easiest way to recognize them is by just checking that they end in pril. Okay, it's pretty much simple. So just think pril, ACE inhibitors. Now, examples of this will include lisinopril, captopril, enalapril, ramipril. I think you get the idea. So when you see a drug that ends in pril, ACE inhibitors, and the idea is always they lower the blood pressure and they reduce the stress on the heart. Okay, so how do ACE inhibitor works? Honestly, just memorize this in case you know the professor that you have is going to ask you about it. But let's go for it. So to understand them, you have to understand something called RAAS system. When the blood pressure goes down, the kidney releases something called renin. This eventually creates angiotensin 1, and then an enzyme called ACE will convert angiotensin 1 into angiotensin 2. Now, angiotensin 2 will be raising the blood pressure in two major ways. First, it will cause vasoconstriction, meaning the blood vessels will become tighter. It's like kind of when you get a hose and you like press it. And second, it causes the release of aldosterone, which tells the kidney to retain sodium and water while getting rid of potassium. So normally angiotensin 2 will be tighter, will be getting more tight vessels and more fluids, and with that higher blood pressure. Now, ACE inhibitors, the word tells you, will be blocking the ACE enzyme. That means less angiotensin 2 is going to be produced. Now the blood vessels are going to be even more relaxed. It's going to be less sodium and water retained, and of course with that you're going to be lowering the blood pressure. So the simplest way to remember the mechanism is ACE inhibitors block angiotensin 1 from becoming angiotensin 2. So ACE inhibitors are commonly used for hypertension because they decrease vascular resistance and lower blood pressure. They're also important in heart failure because by reducing the blood pressure and the fluid retention, they're going to be lowering or decreasing the workload of the heart. So after some myocardial infarction, ACE inhibitors then can help prevent harmful remodeling of the heart. They're also commonly used in patients with diabetes or even chronic disease of the kidneys with albuminuria because they can reduce pressure inside the kidneys and slow the kidney damage. So just think of all of this, just think blood pressure, help the kidney and help the heart. Okay, so let's talk about side effects. I feel like the easiest way to remember this is with the acronym ACE. Okay, A for angioedema. Angioedema causes swelling of the face, lips and tongue or throat. This can be blocking the airway, so if the patient develops a tongue that is swelling or it has difficulty breathing after lisinopril, this is an emergency, so you just stop the medication and get immediate help. C will be for cough. ACE inhibitors can cause a persistent dry cough, and you're going to see a lot of this in testing school. So this happens because ACE inhibitors increases something called bradykinin, and the cough is usually not dangerous, but it becomes, of course, bothersome enough that the provider usually needs to change the medication in some patients. And E is for elevated potassium. So ACE inhibitors can cause hyperkalemia. Why? Because less angiotensin 2 means less aldosterone. Less aldosterone means the kidney excrete less potassium. So less aldosterone, less potassium goes up. Also remember that ACE inhibitors can cause hypotension, dizziness, and changes in kidney function. Last time I said this, ACE, A for angioedema, which is the swelling, this is an emergency. C for cough, persistent cough. Usually, if it's too much for the patient, you can just tell the provider and they can change the medication, but in general, it's not an emergency. And E is for elevated potassium, hyperkalemia. Usually this is going to be an issue if there is another medication that if you have too much potassium, then it gets a toxic reaction or something like that. Now, for nursing care and patient teaching, before and during therapy, you have to monitor for blood pressure, potassium, bone, and creatinine. It makes sense because if it works in the heart and in the kidney, then you just check the heart and the kidney. So because ACE can lower blood pressure, you have to teach the patient to change position slowly. I feel like this is the same for every single medication that lowers blood pressure. You always tell them, oh, you had to stand up slowly. If they let you laying down, sit first, and if you feel dizzy, wait a minute, wait till you feel okay, and then you stand up. Because potassium can rise, then the patient should not start potassium supplements or potassium-containing salt substitutes unless the provider approves them. Also, you have to review any other medication that may raise potassium as well, especially potassium-sparing diuretics, such as spironolactone. And you have to teach the patients to immediately report any swelling of the face, lips or tongue, or any swelling in general, or difficulty breathing or difficulty swallowing. Again, this is an emergency. A persistent dry cough should also be reported, but this is not that much of an emergency. It's more like tell the provider so they can check the medication. And ACE inhibitors should not be used with pregnancy because they can cause serious fetal harm. Okay, so ACE, not for pregnancy. Now, exam recap. For an exam, it's usually the same patterns with these guys. ACE usually ends in peril. They block angiotensin 1 to angiotensin 2, vasodilation plus less aldosterone, plus they lower blood pressure. And the major side effects are angioedema, cough, and elevated potassium. For angioedema, emergency. Also remember hypotension and renal function changes. If the patient has a dry cough, think of an ACE inhibitor. If the potassium is elevated, think an ACE inhibitor. If the patient feels dizzy when standing, hypotension. So, if the patient develops a tongue or throat swelling, angioedema. This is an emergency. I feel like pretty much you can take a screenshot of this and just memorize this for a test because it's usually only this what they're going to ask you for. ACE inhibitors relax the vessels again and they lower blood pressure, but wash the airway, the potassium, and the kidney. Alright guys, hopefully this helped you a lot. Good luck with studying. Subscribe, leave me a comment below and it will help me a lot. Why a comment? Just tell me what you think about the format of the videos, if you think I should improve improving on something. I'm just here to help you and hopefully lower the amount of study time that you're doing right now. Have a good one.